Wake Up Central is proud to be your back to school central with original reporting for you throughout this month. By now, most Arkansas schools are into the new academic year. But as students reunite and educators settle in, the state's top medical minds are watching closely for any signs of a COVID-19 resurgence.
I think we're in a challenging situation with COVID.
Dr. Robert Hopkins is a professor at UAMS and the newly appointed medical director of the National Foundation for Infectious Diseases. He says he's troubled by an uptick in COVID cases that only began in the weeks prior to school.
Right now, I would say in Arkansas in August of 2023, COVID is a significant concern.
It's a concern shared by local pediatricians like Dr. Josh Lyon, who say more and more children are testing positive.
Week over week, about 10%, we're starting to increase.
The Arkansas Department of Health reports COVID cases started to rise in July. The newest graph through August 22nd shows cases statewide jumping by more than 5,000 this month alone.
We know that viruses circulate. We know that kids are very efficient transmitters of viruses.
Dr. Hopkins is also a parent with a daughter in 8th grade. He says schools can be breeding grounds for any illness, and that's where the responsibility of parents becomes paramount.
I'm concerned not only about the transmission piece, but we need to re-emphasize to our parents and to our schools, if your kid's sick, keep them home.
Hopkins says a new COVID booster is in the final stages of FDA and CDC approval and should be available in September.
It's based on one of the Omicron variants that's been circulating more recently. And so hopefully it's going to provide better protection than the previous vaccine.
And while that's good news, Hopkins says Arkansas still suffers from a vaccination rate of only just over 55% of the population.
We've got an awful lot of folks that have not been vaccinated against COVID at all. Folks that have not had COVID vaccination, I would encourage them to go out and get a COVID vaccine today, because you need to start developing protection.
As he explains, unlike the flu that's been around for centuries, the arrival of COVID hit hard and fast, in part because it is still so new.
We've been essentially starting from scratch when it comes to trying to help people develop immune protection.
And guys, educators are facing a double whammy because teachers are playing catch up from the pandemic with students. So having them in class is important, but you want to keep a sick child home. One child's illness can lead to higher numbers of absences, making the retention problem worse.
Definitely a heightened sense of awareness too, not just for schools, but as I mentioned earlier, daycares as well. If there's even a remote possibility they're feeling under the weather, they're sick, do not bring them. And I remember you got some crud.
Tough it out.
Yes.
Tough it out, bring them to school. Not the case anymore.
No, and COVID still can really affect young people quite a bit. And there are a few other strains, maybe even a dozen still out there. This new vaccine, though, coming out in just a few weeks, will hit the one that's affecting people right now.
Okay. Feels like the new normal. Gonna have to get those vaccines once a year, just like the flu shot, right?
It will
Gotta
be.
do it.
Yes, Scott. Yes, well put.